Introduction. Welcome back to Finance Guruji, the place where we discuss all things related to health, finance, and governance. Today's topic is a hot-button issue that affects us all. Is it good for governments to make investments in individuals' healthcare finance? We'll dive deep into this topic, exploring the benefits, drawbacks, and the implications for societies. But before we begin, don't forget to hit that subscribe button and ring the notification bell so you never miss an update. Opening statement. Healthcare is a fundamental human right, and it's also a significant factor in a nation's well-being. When it comes to financing healthcare, there are various approaches, from fully private systems to publicly funded healthcare. Today, we'll focus on the aspect of governance investing in individual healthcare finance. Pros of government investments. Let's start by looking at the advantages of governments making investments in individual healthcare finance. 1. Universal access. One of the primary benefits is universal access to healthcare. When the government invests in healthcare, it can ensure that everyone, regardless of their income or social status, can access essential medical services. This creates a more equitable and just society. 2. Preventive care. Secondly, government investments often prioritize preventive care and public health initiatives. This means fewer people falling seriously ill, which, in turn, reduces the burden on the healthcare system and ultimately saves money in the long run. 3. Cost control. Governments can negotiate prices and regulate costs, which can help control healthcare expenses. This can be especially important when it comes to expensive medications or treatments. 4. Economic stability. Healthcare investments can also contribute to economic stability. When people are healthy, they are more productive, and fewer healthcare-related bankruptcies occur, which benefits both individuals and the overall economy. Cons of government investments. Now, let's consider the drawbacks of government investments in individual healthcare finance. 1. Bureaucracy. Critics argue that government-run healthcare systems can lead to bureaucratic inefficiencies and long waiting times for treatments. This can sometimes result in individuals seeking care elsewhere or facing delays in critical procedures. 2. Financial burden. Another concern is the financial burden on governments. Healthcare can be costly, and funding it can divert resources from other essential services like education or infrastructure. 3. Limited choices. Some people argue that government involvement in healthcare can limit individual choices. In private systems, individuals often have more options for doctors and treatments, but in public systems, these choices can be more restricted. Balancing ACT. So, is it good for governments to make investments in individual healthcare finance? The answer isn't straightforward. It's a balancing act between ensuring access to healthcare for all citizens while managing costs and maintaining quality. Examples from around the world. To better understand this, let's look at some examples from around the world. Countries like Canada and the United Kingdom have publicly funded healthcare systems, providing access to everyone. In contrast, the United States relies primarily on private healthcare, which can lead to significant disparities in access. Conclusion. In conclusion, the decision of whether governments should invest in individual healthcare finance is a complex one. It depends on various factors, including the country's economic capacity, political will, and societal values. Call to action. What are your thoughts on this topic? Do you believe governments should play a more significant role in healthcare financing, or do you prefer a more market-driven approach? Let us know in the comments below. And if you found this discussion informative, don't forget to give us a thumbs up and share this video with your friends. Also, subscribe for more insightful content on health, finance, and governance. Thanks for tuning in, and we'll see you in the next video.